any type of optimal therapy is going to take advantage of both of those as a possible way to maximize the result or get the intended result you want.
You're listening to the Ethos Athletes Podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, it's Dr. Matthew Hernandez, and you're listening to the Ethos Athletes Podcast. Today, we're continuing our series on peptide therapy. And for this series, we brought in Ryan Smith, who is the founder of TaylorMade Compounding Pharmacy, which is a specialty pharmacy that specializes in peptide therapy. So Ryan, welcome back to the show.
Yeah, thanks for having me again.
So this episode is episode 2 of our Peptide Series. And what I wanted to really focus on this was looking at peptides that help with sleep, weight loss, and energy. And these are some peptides that we use in our practice pretty frequently. We get great results with them. Patients love them. And it really does help add another layer to the treatment plans that we use here. And I'll talk a little bit more about those, but let's get into understanding how some of these peptides work. And we're going to be focusing on 3 today, as well as a protein technically. So let's talk about, there's 2 ways to split up this category. So one is going to be growth hormone secretagogues, and then the other one is going to be regulating LH and FSH. So before we get into that, we talked about in episode 1, the basics of peptide therapy. And essentially, Ryan talked about how peptides are a chain of amino acids that are put together in our body. They're naturally occurring in many cases, and they actually go and signal our body to do a number of different things. And so we'll talk about what some of those are today. And yeah, we'll go ahead and do that, go from there. So that they are signaling molecules. And again, we're going to start with some of the growth hormone secretagogues. So for this part, for growth hormone secretagogues, can you tell me a little bit about what a growth hormone secretagogue is compared to, and what growth hormone does, why it's important, and then, we'll go from there.
The growth hormone conversation almost, started in the late 90s because there were a couple studies that were done that showed all the benefits of growth hormone, almost sensationalized. And there it sort of kicked up because it can help people, help with cardiovascular disease. It reduces, in some instances, triglycerides and some C-reactive proteins. So markers of health related to cardiovascular disease. It can help with, metabolic issues by, causing some changes in body composition. It can help with skin elasticity. And so it was really labeled, this next generation, this life-saving drug for anti-aging. And there are definitely some components to that. But the growth hormone secretagogues came along not long after, actually. And these are, instead of just being regular growth hormone, these encourage your pituitary to naturally secrete growth hormone. Mm-hmm. One of the things that happens is you have a precipitous decline in growth hormone, whenever you get into your late 20s. You have a fraction of what you once had. And so the idea is, hey, how do we modulate that for better quality of life for all those reasons I just talked about? A lot of people chose and have chosen to date the exogenous growth hormone, but the peptides give you another tool to do it a little bit more naturally, go a little bit higher up in the pathway and encourage your body to release it just like it would whenever you were younger.
Yeah, and that's a good point. And the benefit of doing that is that we don't shut off by taking an exogenous. So that means an outside source. Your body doesn't naturally produce growth. Your body naturally produces growth hormone, but if we take an outside source of it and we take straight growth hormone and inject it into ourselves, it shuts down our body's ability to be able to produce its own. And so peptide therapy helps improve the signal of growth hormone and increase growth hormone levels without, necessarily doing harm to our body. Correct?
Absolutely. And to add on that, another one of the big things is regulation. You can't really down-regulate exogenous growth hormone. You're giving it a certain dose, and along with that, you can come along with some side effects. If you overdose growth hormone, you can have, organ enlargement or carpal tunnel type syndromes, or you can cause changes to blood sugar. And so too much is definitely a bad thing, a very bad thing. And so, by going a little bit higher up and allowing your body to control it, you have some negative feedback pathways, which are a little bit safer and more protective.
So let's talk about some of the peptides that we can use to improve growth hormone. The 2 that we use are CJC, I believe it's 1295, and the other one is ipamorelin. Can you tell us a little bit about these are two different peptides, but they work synergistically. So can you tell us a little bit about how that happens?
Yeah, definitely. Yeah, there are two areas on your pituitary, two receptors, I should say, which regulate growth hormone release. The first one is used to accepting a signal from your hypothalamus, so directly from your brain. And then the other one accepts another hormone called ghrelin, which people know as the hunger hormone, which there's a lot of interesting new science there. But the important thing to know is you do have two receptors on the pituitary. So any type of optimal therapy is going to take advantage of both of those as a possible way to maximize the result or get the intended result you want. So the CJC mimics growth hormone releasing hormone, and then the ipamorelin works on the growth hormone secretagogue receptor, particularly growth hormone secretagogue receptor 1A. And together, they are much, much more synergistic and allow your body to produce and release the sort of the maximal amount of growth hormone.
Okay, and the benefits of doing this again have to do with a lot of the ones that you listed earlier. But I found in my practice a lot of people when we put them on CJC ipamorelin, the first thing that they notice is that they actually get better sleep, or that usually that's one of the first things that they pick up. Can you talk about how it particularly impacts sleep, if you're able to talk a little bit about that, and then some of the other things that they could expect with this?
Yeah, definitely. The sleep is the very first thing I would say most people see. It can happen on the very first, dose of this product, which is nice. People have much, much higher quality deep wave sleep. One of the things that we've seen is now with more people doing biometric type screening, we see deep wave sleep significantly increased across a lot of metrics, which is a really good thing because it's sort of hard to increase that stage 4 sleep with a lot of other, products. The other thing that I would say that we see typically is the number one thing that people generally report is change in body comp. Growth hormone is one of the very few hormones which is both anabolic to muscle tissue and catabolic to sort of fatty tissue. And so people see some body comp changes due to increasing that natural level of growth hormone and IGF-1. And then lastly, we see just more energy in repair and recovery. People recovering from injuries a little bit quicker or surgeries a little bit quicker, and having just a little bit more energy throughout the day.
Yeah, that's those are fantastic. I mean, those are all things that we've experienced and that patients have been really happy with in our practice. And again, this isn't, it's the therapy itself is phenomenal. Don't get me wrong. It's not a cure. It's not like a magic pill, right? And so obviously people need to be careful with thinking of it that way.
Definitely. And to speak to that too, you need to have it definitely medically supervised because, stimulating it too much or, not enough, you have to really, follow the science on there and do it and dose it the right way.
Yeah, absolutely. Now I've heard of some physicians using CJC ipamorelin and when they dose it, some people will go and dose it with breaks in between each dose. Like you finish off a vial and then you take an X amount of period off. Have you seen that to be true in most cases, or they go continuously? How does that work?
Yeah, it really depends on the particular indication, but both make sense depending on particular. One of the biggest things we worry about is downregulation. A lot of these pituitary receptors can, if they're stimulated too much, you can develop tachyphylaxis and they'll stop responding. And so that's the last thing we want is to downregulate a receptor. And so conservative dosing is always what we recommend. And if that means breaks, a lot of times that's the suggested course of action.
Yeah, absolutely. We talked about it impacting body composition. So I will say, like when we've seen the best results for this is when we've gone in our practice and dialed in nutrition and also making sure that individuals are exercising. Particularly in ours, we go and encourage weight training, and then also making sure that hormones are balanced and stuff like that. And so when we've done those things and we've added peptides on, people have gotten really good results, and they've done them a little bit faster than they would have otherwise, which is fantastic. So I don't know if that's been your experience with the doctors that you've talked to as well.
Yeah, definitely. And to reiterate your point, on magic pill, it definitely requires multiple lifestyle changes. It's not going to, all that stuff is synergistic and definitely something to be considered.
Yeah, absolutely. So let's talk about our next peptide. And we talked about again how it helps with sleep and stuff. So what are some of the other peptides that can aid in that part? Because again, we're looking at sleep, energy, weight loss, and overall just hormone balancing for today's episode.
Yeah, so one that would work on both hormone balancing and sleep is one called delta sleep inducing peptide, which I know you have some knowledge of and some experience with.
Yeah.
The DSIP is, as we call it, is an older product. Actually, originated in the late 40s, and so it's been around for a long, long time. Originally isolated from rabbits, and they actually still don't know the mechanism of action, how it's working. But what they do see is that in a lot of paradoxical sleep conditions, it can really help encourage sleep. And so that one is definitely one I would mention. But again, sort of transitioning to more of the hormone component, one of the other benefits is that it has a really big benefit of increasing LH in some patients. So some people will use this as a way to increase their endogenous testosterone levels, just like we talked about going up a little bit higher in the pathway. Instead of actually having to dose exogenous testosterone, you can work again on that hypothalamic level to increase your luteinizing hormone, which increases your testosterone.
Yeah, and it's been fantastic. I mean, you get the biggest surge of LH when you're in that deeper stage of sleep, and so essentially what this does, it increases that surge, correct? Which then allows you to produce more testosterone during that time.
Well, yeah, definitely. And that like I said, the mechanism of action is still a little bit uncertain, but
right.
That's definitely I should say the hypothesized mechanism of action.
Yeah. No, that's perfect. And then with testosterone, we have the benefits of going and increasing energy, libido, muscle mass, stuff like that, and we're able to do it without, again, taking an outside source of testosterone, which then our body can become dependent on, or because we're shutting down our own natural production. So peptide therapy allows us to avoid that aspect by naturally increasing LH. Going back to CJC, apomorelin, and then also DSIP. Have there been any studies on these, or what studies have you seen with these particular ones? If you could talk about a few of them.
Yeah, definitely. So, with the CJC apomorelin, there's very little done as a combination, but that's changing. I know a lot of people collecting data and are about to publish the two together. There is plenty of data on the growth hormone releasing hormones as it relates to, risk of cardiovascular disease. One of the most popular growth hormone secretagogues besides the CJC apomorelin is the tesamorelin. It's a very, similar mechanism of action. That one's FDA approved for AIDS lipodystrophy, has a ton of studies on helping reduce that visceral adipose tissue and reducing C-reactive protein and risk of, like I said, cardiovascular disease and those abnormal events like, heart attack and stroke. And so the data is comprehensive on a lot of things. For the DSIP, I mentioned it has studies on its LH increase, it has studies on how it affects some sleep disorders. It also, strangely enough, has some data in helping with pain and seizures, reducing seizures and reducing the amount of pain. And so we know it's a pretty multifunctional pleiotropic product, which is exciting, but definitely needs a little bit more research.
Yeah, absolutely. I talked about those two and how they both improve sleep, which is fantastic. Again, also with improved sleep, you're going to get more energy, wake up feeling more refreshed, all that good stuff. Let's go on to the next one. And this one I'm excited about because this one's a really interesting one with regards to hormone regulation. So Ryan, if you could tell us about this next peptide.
Yeah. So the one of the other ones that's really interesting and it has a lot more data coming out about it is called the Kisspepsin. Particularly, there are two variants of Kisspepsin, and the name is actually pretty funny because it was originally the Kisspepsin gene was discovered in 1996 in Hershey, Pennsylvania, and so that's the reason they named it sort of the Kiss gene, and then the same year they actually found the receptor on some of these neurons, which receive stimulation. And so the Kisspepsin is part of a large neuronal pathway, but it's largely, I should say, related to its increasing, again, of LH and FSH and regulating those pathways. And so whenever you modulate LH and FSH increase, you can, again, increase endogenous testosterone levels. It also has some studies in fertility for women as well. And so it's one that would work more on the LH, FSH, just like DSIP does on the LH.
Now, I've heard, and you can correct me if I'm wrong, I've heard a few doctors who are able to use this to help wean men off testosterone, or to use it as a replacement for Clomid as well, which can also increase testosterone by working on LH. Can you speak a little bit about that and some of the data that you've seen for that?
Yeah, absolutely. I mean, we've seen even just from an anecdotal story, patients' testosterones and LH jumping really, really high, up to 300 points with 400 points with just this as a standalone. And so we know, it can be used to increase that natural level and sort of save people from a little bit of that andropause, this low testosterone, which contributes to a lot of unfortunate side effects. Another thing we see is that it also has an effect on sexual function. For some people, this can be sort of an erectile dysfunction type of reset. It almost resets that central nervous system. And again, not well described in the literature, but one that is being looked at as a new pathway to sort of treat some of those causes of erectile dysfunction.
Now, when we're looking at individuals who are coming off testosterone or who are getting their Clomid replaced, and we can use Kisspepsin to correct it, do you know the data on, is Kisspepsin something that they need to stay on for the rest of their life kind of thing in order to achieve that? Or is it something that's temporary that can help, they take X amount of time and then after that their body's reset?
Unfortunately, it definitely looks like the results are moderately temperate. And so, you can see some patients who will have the LH increase for 2 weeks, others for 4 weeks, but ultimately it tends to always sort of reverse to the baseline. Okay. And I would say it's not the same what we see with erectile dysfunction. Sometimes that reset can be a sort of a lasting type of solution.
Awesome. No, that's perfect. And then let's go on to the last one, which is actually one that most people are familiar with. It's technically a protein, but it's HCG. So can you talk to us a little bit more about that?
Yeah, no, then I appreciate you giving me the opportunity, because that one is one I think that is often, a little bit confused, because it actually is it's a protein, like you said, not a peptide, but it has two subunits, and actually it's one of those subunits which looks a lot like LH. And so this is sort of an intermediate between testosterone and acting on something like Kisspepsin or DSIP, which act on the hypothalamus. This is sort of right in the middle, where you're directly stimulating those LH receptors with a variant of LH to increase, testosterone or to act like FSH. So a lot of people will use it, as while on testosterone therapy, to maintain Leydig and Sertoli-cell testicular volume. And it's definitely a therapeutic tool that's interesting to use. But I think it's important to know that is, again, how it works.
Yeah, no, I think it's really important to bring that up. A lot of people are really familiar with HCG, and especially its use with testosterone therapy as well. And so for the reasons that you mentioned. And I mean, yeah, it's good for people to understand and to know that it's definitely an option out there that's available to them.
Yeah, absolutely.
Do you have any other things to add with regards to using peptide therapy, different things like that for energy, sleep, stuff, and hormone balancing?
Absolutely. Just as a cool aside, I think that one of the interesting things is, the fasting mimicking diets and things are becoming very, very popular. It's interesting to know that Kisspepsin also has an intimate relationship with fasting states, where it decreases pretty substantially whenever you fast. And so some people are investigating, how that works, and maybe with modulating that relationship while fasting give you even more benefit. And hopefully, maybe the next time we'll talk about a little bit more information on that.
Yeah, no, absolutely. And I definitely like to bring up the fasting mimicking diet as well, because that is something that we use in our practice, not only for hormone regulation, but also for when I'm doing my regenerative medicine for joint pain, stuff like that. We definitely put people on that because it's been shown to help with tissue healing, various things like that when we're going and treating joint pain. So yeah, we can definitely get it more into that down the road.
Sure.
Awesome. Well, I think we threw a bunch of info out at y'all today, so we'll go ahead and leave it with that. And again, just to recap, there's a few different things that we can do with peptide therapy to actually help with sleep, energy, hormone regulation, that actually improve our body's ability to naturally to improve that, as opposed to having to take an outside source of a given hormone. On the next episode, I'm really excited about that one. We're going to be talking about peptides and regenerative medicine in the sports medicine world, and how we can use these to help things like recovering from surgery, recovering from procedures, such as PRP, stem cell procedures, different things like that, as well as helping with arthritis, so shoulder pain, knee pain, different things like that. Again, we'll have Ryan on for that episode. So Ryan, thank you again for being here today.
Yeah, thanks. My pleasure. I look forward to next time.
Awesome. And then we'll catch you on the next episode. Thanks for listening.